Good afternoon. Once again, I'm Mark McClellan from Brookings. I'd like to welcome you back to today's session on the report for the National Medical Device Postmarket Surveillance System. We've got two very interesting panels coming up before we conclude today. The first, as I mentioned earlier, will be a panel with key congressional staff discussing the current legislative activities and possible activities related to medical device innovation and regulation. And then the last session of the day is going to focus on extending out some of the ideas we've talked about today in terms of both implementing a medical device surveillance system and in terms of assuring its effective interaction with the many other steps taking place right now in our healthcare systems towards better evidence. So we're going to go through both of those issues. Now is a good time for our panel to come on up to the stage while I introduce them. We have very pleased to have with us some very busy people who are leading congressional committee efforts on issues related to medical innovation and post-market surveillance. They're from the congressional authorizing committees that oversee the FDA, that really oversee a broad range of activities related to healthcare policy and especially biomedical innovation policy, include staff from the Energy and Commerce Committee in the House and the Health, Education, Labor, and Pensions Committee in the Senate. They have been very busy lately, in particular, on issues related to medical device innovation and the safety and effectiveness of medical devices. We're going to talk about some of those activities right now. We're going to talk about how those activities relate to the issues presented in today's report on a post-market medical device surveillance system. I do want to emphasize that the views of the panelists are their own. They don't necessarily represent the views of any particular member of Commerce or what may or may not actually happen in legislation. And we've asked them to speak as freely as possible in this process with that in mind. So I'm very pleased to introduce Wade Ackerman, the Senior FDA Counsel for the Senate Help Committee. Grace Stuntz is a professional staff member on the Senate Help Committee. Clay Allspark, the Chief Health Counsel on the House Energy and Commerce Committee. And Eric Flam, FDA detailee, who is serving on the House Energy and Commerce Committee as well. We're going to start out this session by giving a little bit of perspective on what is going on now related to these issues in the Senate and the House. So to do that, I'm going to start with Wade and Grace to talk about current activities in their committee, including those related to the medical device surveillance report, and then turn to Clay and Eric to talk about the House Energy and Commerce Committee activities, including the 21st Century Cures draft legislation. So Wade, Grace, start with you all, and then we'll go from there.
Thank you, Mark, and thanks for having us here today. Again, off the record, in case that wasn't clear enough from the beginning. So after kind of November and Senator Alexander was going to be chairman, one of the things he wanted to look at was how do we get drugs and devices to patients faster? I think both with Chairman Upton's effort and speaking to folks back in Tennessee, that's something that was going to be a big priority for him as chairman and is one of his top 3 and probably his biggest health care priority. But I think, as all of us know, that's not necessarily a new problem. People have been trying to find ways to get drugs and devices to patients faster since, the 92 user fee agreements, the 1997 FDA law, the 2004 critical path report from FDA raised a lot of those concerns about what FDA needs to sort of keep up with emerging and fast science. And so the way that we wanted to start the process over in the Senate was he wanted to write a report, and he worked with his colleague, Senator Burr from North Carolina, that sort of laid out, what is the current framework. And I think the Brookings report today does that great for the post-market space and devices. It's really helpful for us up on the Hill to actually know what's the current state of play. Before we start trying to change anything or improve upon things, what programs exist now? What have we been trying to do for the last 10 years to solve these problems? Has it worked? Has it not? Do we have the data to know if it's working or if it's not working? How do we get that data? I know Brookings wrote on that as well in February. And so that was sort of the Innovation for Healthier Americans report that came out in January from Chairman Alexander and Senator Burr, tried to sort of our best shot at laying out the broad framework of what exists sort of all the way from the NIH basic science side to sort of FDA and their tools. I mean, it seems in the FDA space, we legislate either every 5 years on a schedule with user fees, and we have sort of a hard deadline, or as in the meningitis outbreak, there's a public health crisis that requires urgency. I think we're all excited that we're taking this year that's sort of, knock on wood, sort of between those two events to really take a step back and look at, every 5 years we've added more authorities, we've added different reporting requirements, different post-market systems, different pre-market tools. What does the whole system look like, and is it where we want it to be? The answer might be it's fine and Congress don't mess it up, right? Or it could be, well, we could consolidate here, we might want to strike here, some additional authorities would be necessary. And so the report really tried to lay out those questions, and we expect to, really want folks to say in those comments that we will be sharing with the whole bipartisan help committee, here's where Congress should be focusing on helping, here's something that Congress could start the dialogue about but maybe shouldn't be legislating, and here's something that Congress should stay away from or isn't really a high priority problem. And as some of you may know, the House is hoping, I think, has started about 6 months before we did, and so we're hoping to start our own process in the Senate. I think Wade will talk a little bit about how that will work, because it is going to be bipartisan with both Chairman Alexander and Ranking Member Murray leading the help committee to come up with sort of what we can do to help here, whether it's getting new things to market, whether it's sort of making sure FDA's job is as easy as it can be, because they as well want to get new innovative therapies to patients. So how can we help them? Sort of, I think, an unusual question for Congress to be asking, but I think here, on both sides of the Capitol, it is what we want to ask. How can we help FDA, NIH, America's biomedical research kind of ecosystem do better? And we look really forward to working with the House, and then also, starting now with our Senate team and our bipartisan help committee process that, if you've been around, has worked very well for the past few years, although it takes a little longer. But so now I'll kick it over to Wade to talk about that.
Sure, yeah. And again, thank you, Mark and Brookings, for having us today. As Grace mentioned, I think some folks in the room may be familiar with the way we've been successful in the Senate Help Committee in getting legislation in this area done. But for those of you that aren't, I think it's worth just a moment explaining a little bit about how that looks. The Help Committee has very active members who are engaged and have a lot of priorities and history in this space, and that goes for the staffers across the committee as well. And just last week, we kicked off this innovation working group to look at some of these issues. And what the working group is really is just a group of staff from across Help Committee member offices who get together. We're going to start by sort of making sure everyone's speaking the same language and bringing in a lot of information. We started with NIH officials briefing the committee staffers last week. I think this week we're moving to FDA for Dr. Shuren with the device issues. Next week we'll be talking about drug issues and biologics issues. And then NIH and FDA will be coming in and doing a duet, so to speak, talking about development of medical products from the stage of invention to the time that those products reach patients. So that will be phase one, so to speak. And from there, really what happens is the staffers come in and roll up their sleeves and start vetting policy thoughts. We get out whiteboards and we have a very transparent process. You can follow it by going to the committee's website. In the past, when we've reached places where there might be language to discuss, we've released those for public comment. In the past, we've also released questions. It'll depend upon where the process takes us, but it's a really deliberative and thoughtful process, which I think recognizes the complexities in these areas. And we've really had a lot of success in the past. I don't know,
Yeah, I mean, I've been with the committee since 2011, and this is the same way we did the user fee bill that was done in 2012. We had draft discussions for every sort of title of that bill, and I think it made the process better, having people put in comments for compounding and track and trace, two very complex issues. That's sort of the same. We had every member who was interested in compounding come give us their thoughts and their ideas, and that went through a lot of different phases and vetting processes as well. So looking forward to working with you all and look forward to your questions.
And I think I'll just, one last comment. I say, yeah, it's a very deliberative process, and I think stakeholder input and Things such as the paper that was released today, those things are critical as we go through this process. My boss, Senator Murray, is very excited to be in her new role as ranking member of the Help Committee and working with Senator Alexander on this initiative. But just to underscore the importance of stakeholder feedback, it's a long process, and we work very closely with FDA through technical assistance through these processes to reach what, again, we've been very successful in the past, reaching consensus policies.
Thank you. Also, turn to Clay and Eric.
Well, thank you very much for the invitation, and thank you to Mark and his team for all their input during 21st Century Cures. And to those in the audience as well, there are a lot of familiar faces, so it's great to see you today, and we look forward to a good discussion. Again, I'm Clay Allspark. I work for Chairman Fred Upton of the Energy and Commerce Committee. About a year ago, we started the 21st Century Cures Initiative. We, as in Chairman Upton and Congresswoman Diana DeGette. And the idea behind the 21st Century Cures Initiative, it's very similar to what Grace outlined, is to really look at the whole entire cycle for cures and treatments, from discovery, development, to delivery, to try to better understand really where we are, get a landscape view of where we are in this country in helping patients, but also in that conversation is to figure out what more we can do. So it's been a very helpful process. It's been a great discussion, and it's involved 8 subcommittee hearings. We've had 12 roundtables across the country, 4 here in DC. We've also put out some white papers where we've gotten some great comments, and I want to say thank you to all those in the audience. I know Dr. Shuren's here. He was able to participate not only here in DC, but also out in Michigan, coming to Chairman Upton's district, and we can't thank you enough for all that. And from that phase of the 21st Century Cures Initiative, we are better understand kind of where we are in this country, and as well in respect to each area and what we can do, but also through your help to try to figure out what more we can do. Because as something we've talked about through 21st Century Cures Initiative, there are almost 10,000 diseases out there, and we only have cures and treatments for 500 of them. And that's just simply not acceptable. We need to work together, roll up our sleeves, and figure out what more we can do. So like I said, we had that whole process trying to get input, and that process will continue. But what we did last month is we put out a discussion document where we collected ideas in every facet of the cure cycle to better, basically, hopefully further and accelerate that cycle. And I think one important part of this process, as I look at it, we've had an opportunity to work a lot together on the FDA side. And a lot of focus every 5 years is on FDA, and the fingers are pointed at FDA to say, hey, they're the roadblock. We need to figure out what to do. But I think one thing that will hopefully separate this process is to better try to step back and realize that, you know what, this is an entire cycle. It's not just development. There's a discovery aspect, and there's a delivery aspect as well. And one thing that you do in the delivery side, for example, or development side, may have an impact on another part of the cycle. And that has been at least on a personal level, it's been a very interesting, challenging part of this process. And I thank everybody in the audience for helping us better understand that. And one thing I want to say is we look forward to continuing that process, because that discussion document was just that. It was ideas that were put out. And we know that there are better ideas out there. We know that every single idea in there can be improved. But that can't happen by just, we sit in Rayburn House office building. The greatest ideas aren't coming out of there. The ideas are coming forward from the country. They're coming from the relevant agencies here in DC or have offices around the country. We need your help. And I want to say thank you for those who have reached out already. We've gotten a lot of comments on the discussion document that we put forward, but we also look forward to continuing to get that feedback. And I think that's kind of where we are today with this conference. Is there's an idea put forward on the table. This whole thought of real-world evidence and better post-market collection of data is really where I think we need to be headed in the 21st century. But how to do that, that's where we really need help, because it's like any idea. Some ideas sound great at the 50,000-foot level, but really the details are what matter. How to operational it is what matters. And this discussion today will hopefully put us in a place where we can better understand that and possibly push it forward as we look to these different initiatives. So thank you very much.
Thanks, Clay. Eric?
Thank you, Mark. It's a pleasure to be here. So, 4th time saying the same thing. Mr. Pallone, the Democrats on the committee are also very supportive of the effort. We also think it's important to look at the total scope of discovery, delivery, development, not in that order, of course. Our primary hope is out of this will be to get more money for NIH and FDA to improve research. We see that without getting more money, there isn't really going to be a lot of change. Our focus relative to FDA is, I think, first to, and NIH, to remove any barriers, and that's something that both sides of the aisle are looking at. It's something that's not controversial, it's not partisan, it's not always easy to figure out how to do it. Some of the barriers don't seem to be as easily amenable to congressional efforts, but we will try. We're also looking to make sure we don't undermine any of the evidentiary standards that FDA uses for determining safety, for determining effectiveness. I don't think anyone but either side of the aisle has any intent to do that, but there is some stakeholders see this as a great opportunity to get everything they ever wanted. And because it's not a user fee cycle, sometimes they think they can get things that during the user fee cycle they might have to pay for. This isn't a negotiation with industry talking about user fees, so maybe they can get things that they couldn't otherwise get without paying for them. So we're sort of looking out to make sure, and we have been, we meaning the House side, the committee, have been having FDA and NIH in sometimes twice a day for 2-hour sessions, sometimes 5 times a week. Considering FDA is not located in NIH and neither of them are located downtown, it shows how important they see this, both from the perspective of improving things and from the perspective of making sure what looks good doesn't end up making things a lot worse. We're also looking to figure out ways to make better use of the science. You know, real-world data, real-world evidence, big data, biomarkers. How can we make better use of them? I think there have been proposals that take things too far in the sense of assuming that all the research has been done and now it's just a question of why hasn't FDA implemented them? Why hasn't FDA created approval processes that make use of them and speed them in the drug regulatory framework? And I think we've heard from FDA that those are premature, that they're not going to help. They would actually slow things down. They would deter FDA. They would distract FDA from doing its review processes to do things that it's not equipped for and that really is in the scientific community's domain, particularly in biomarkers, developing them better. So we see a lot of potential here. We see a lot of risks if we don't do it really carefully. That's why meetings like this, stakeholders like you, are really important. I think both sides of the aisle share the same policy goals, and we just have to work really hard to make sure that what we achieve doesn't undermine the great successes that have been going on, particularly at FDA.
Thank you all for the comments. Really interesting to hear the sort of the breadth of similarity and interest and goals for this process that all of you have expressed. I did want to push a little bit on the post-market side, since that's our real focus here this morning. As you all pointed out, this is one piece of the whole 3D discovery, development, delivery infrastructure. But it's one that historically hasn't gotten very much of the resources at the FDA side, and where, compared to other countries and systems, we're sort of a bit behind in terms of infrastructure. So I don't want to put you on the spot about the report released this morning, but maybe if you all could comment a little bit further on what you've heard so far about real-world evidence, the development of post-market systems. Clay, I think you mentioned that there was a lot of interest interest in developing better post-market capabilities, better real-world evidence capabilities. Any other insights or further insights so far about what you've heard on the kind of the post-market side, especially for medical devices?
I think one important element, and Eric touched on it during his comments, is how challenging and difficult it is. I think that as we go into it, we don't want to underestimate how difficult and how challenging it is going to be to get to that place and to get to where the science is there and the data collection systems are there. There's a lot of information, I would say, that's being collected on the post-market basis now, especially on the device side. But I think one intriguing part of the report was the identifying, here are the data systems, here's the information that's being collected. What if we were able to really harness that and make it win-win for everybody?
Reduce the cost of collection.
Reduce the cost of it. And that, I think that's a very intriguing part of the proposal, and I think something that was very attractive to us as we look at it as well. But with all the information that's out there, with how data are being utilized in not just health, but in other areas as well, that's what's intriguing. We talk a lot about the pre-market side, as you indicated, when we talk about medical device user fee or the prescription drug user fee. But I think Jeff, Dr. Shuren brought it up in our initial roundtable, and FDA's been talking about it, others have been talking about it, about the balance between pre-market and post-market. And we may be able to, I don't want to say lessen the pre-market burden, but it may be that on the post-market side, we may be able to collect more data to have more, just a better sense of confidence as to, and I say we as in when the regulators are doing that, to get a better sense of confidence when they clear and approve those products. And I think that would be a very good benefit of this, not only to make sure they're safe, but also how effective they are too. So I think the report has a lot of great aspects to it, and we look forward to continuing to deep dive into it.
Other comments?
Yeah, I'll second sort of Clay's remarks. I think that's the last thing we would want to do is create a brand new post-market surveillance system that's costly for people to set up and doesn't incorporate the data that's already being submitted by companies. And there's all new issues with setting that up without knowing how it works with everything else in the bigger system and how things across PCORNet and different registries that companies and specialty societies are using, and what the current reporting for adverse events, is it useful? If it's not, is there a way to make that system more useful so those resources that FDA and others are spending can be used to do a system that's sort of more effective? Those are the questions that I think we hope to answer. I think your report goes a long way in helping identify the key pieces, and look forward to hearing on, when you have the solution, you can just let us know, and then we'll go from there.
Sounds simple. I appreciate the openness. Any other comments? Great. I'd like to open up to those of you here in the room. Any questions or comments for the congressional staff up here? I did have one more while you all are thinking of that. You all have both framed both the HELP efforts and the energy and commerce efforts around innovation and taking advantage of 21st century progress. And it is a really comprehensive focus, though, covering all the 3Ds. And I don't recall seeing that put together in quite that comprehensive of an approach. As you all mentioned, this is kind of on the off cycle between the FDA user fee legislation, which has been really focused on FDA and its role in regulation and maybe supporting innovation, and other legislation that may come up in response to things that happen in the world. Drug tracking issues and safety issues and the like. Do you see this being an ongoing priority for the committees now? Is it kind of a reflection of how important not just biomedical innovation has become, but how important it is to take a more systematic look at what Congress and all of us can do to support effective innovation? Is this part of a bigger trend?
One part of this initiative is, and I thought you said it well, we had the 2006 NIH Reform Act, or we have the user fees, or in the SGR vehicles are oftentimes for some kind of Medicare reform. But as we're looking at those, we're only looking about that one part of the cycle. I think with 21st Century Cures and with Chairman Alexander and Ranking Member Murray's initiative, one thing we're doing is we are looking at that entire cycle. I think one of the policy goals that you'll see as part of these, at least as 21st Century Cures, is that how can we put a process in place so that we can maintain and look at that cycle when we're not looking at one of those pieces of legislation? Because sometimes it comes every 5 years. And a lot of times in Congress, it's just how Congress operates is we are focused on that public health crisis or that latest patch. But if we could put some systems in place, some policies in place that will have an ongoing effort to look at how the cycle's working together, I think that would be a really positive impact of this initiative.
The rest of you see that similar way? Or?
Well, I can just add, and Grace, I think you want to throw something at me for saying, and Colleen Erickson, same way, is that sort of, it goes without saying that also, the committees, there are a lot of ways that we engage in these areas. There is legislation, of course, and that's what our working group in the Senate at least is looking at now, but we also continually do oversight of these issues and have other levers that we have at our disposal. As Grace said, there are some areas where we may find that authorizing changes need to be made. There may be some areas where they don't. There may be some areas where, because Congress is engaging, the conversation is able to be had externally at the agency and other places that sort of moves the ball forward in the right direction. And so all of those activities sort of are relevant here, I believe.
And it's sort of hard to speak for Congresses of the future, and that, I can't tell you that, if there's some big patient safety issue that the drug or device creates, that we're not going to have, FDA come up and point at them and say, how dare you? But I think, because we've seen that happen in the past, and but I think it's good, the conversation that Congress is sort of having this conversation about, what is the appropriate risk-benefit? And it sort of helps the FDA and others have that discussion, feel more comfortable, making sure they are using the best science and getting these things out, and that hopefully it's not just sort of Congress pointing fingers, it can be more of a working together dialogue.
I would say, one of the most influential outside groups with respect to Congress is the drug industry and the device industry. And in the past, they have focused on FDA. What we heard a lot of at the roundtables and hearings that we held during 21st Century Cures was the drug and device industry saying FDA is no longer, and the investment community, VC community, FDA is not the problem anymore. So they're moving away from FDA. They're looking at how can we incentivize better ways to use clinical trials, to get data in a way that if you have biomarkers that show this indicates that this is the right patient group, that you can use a smaller size clinical trial patient group, and then you can have better answers. So the drug industry is looking more at the discovery side. And then they're finding on the delivery side, well, FDA does very fast approvals based on sometimes what some insurers and other outside groups tend to think of as the minimum amount of data necessary to be able to get the drug or device to patients. And then CMS says, well, that's not really enough data for us to decide this is worth paying for our patient group. And so then they're seeing, though, there's really a need to focus on the delivery side. And so given the influence of the drug and device industry, I would guess that there will be a continuing focus both on discovery and delivery as well as the FDA part.
Very interesting. So I have time for one more question up here. Sharon?
Thank you. I'm Sharon Lees Norman. I'm a professor for biostatistics and healthcare policy at Harvard, and I also lead the Methodology Center for the Medical Device Epidemiology Network, MD-EpiNet. And so I had a question that focuses on the delivery aspects, and it strikes me as extremely odd that we can assess the delivery of drugs in looking at large claims databases because of the existence of national drug codes. And forever we do that. We assess things, and we've learned a lot. We can't do that with medical devices. And I know it's warned that perhaps I shouldn't raise this issue, but
Nobody warned you
okay.
not to raise this
No,
issue,
okay.
at least that I know
I'm
of.
not looking at you, Mark. I'm not looking at you. But
They're open, they want to hear everything.
I'm very struck why we don't have, or we were not going to sort of mandate that in claims data there's a UDI. If you want to assess the delivery of how medical devices are delivered and how safe and effective they are, it seems to me that you need to be able to track those things in claims data. So that's my question is, don't you see that as something quite important, and is it something that you're thinking about in order to assess the delivery of healthcare in terms of general public health?
Either as part of this process or more generally, any thoughts about getting UDIs into action? Everybody's generally for it, but it's like one of those things that turns out to be difficult to actually make progress in practice.
I mean, I'll start. It's definitely on our radar. I don't think we want, device companies don't want to make the investment to put UDIs on devices to have them never be used for them or for other purposes. And we work closely with our finance committee counterparts on this, as they have jurisdiction over some of the other issues. We have some jurisdictional differences in HELP and ENC, but it's something that we've talked to them about, and we're talking to agencies about as well. And so it's on our radar whether statutory fixes. We're not there yet in our thinking, but no, it is something that folks in the Senate side are talking about, and I think some senators have sent letters, and we're working on it for sure.
Yeah, I mean, I think we all agree it's really important. It's sort of late, NDCs have been around a lot longer. And how you do it and how expensive it is and how much resistance there is given the expense will all affect what we're able to do. I don't think anyone here disputes the importance.
I think from this panel, the level of interest in addressing some of the issues that we've been grappling with on this report and in the discussions this morning, the level of interest is clearly very high. So there's a lot of recognition of the importance of developing better evidence from practice and a real willingness to hear about practical solutions to get there, including on some of the challenging issues like UDI implementation and how to get this device surveillance effort off the ground. So this is going to be a continuing process, but it's terrific to see the level of engagement from you all, from the members of Congress around what is a key part of getting to a more innovative and effective 21st century healthcare system. So thank you all for joining us this afternoon. Thank you all very much.